I'm Dr. Venkatesh Reddy. I'm a peripheral vascular and endovascular surgeon. Most of the people don't know the vascular surgery. Vascular surgery is a subject where we deal with the arterials and the venous system. Mainly the arterial system, people present with a non-healing ulcer, gangrene, those kind in the leg and in the hands, those kind of conditions. Whereas the venous problem comes to the patient who's got a varicose veins, there is a big dilated veins, and some people come with a deep vein thrombosis. This is basically we'll deal with most of these problems. Then also we'll deal with in abdomen some arterial problems like aneurysms, aortic aneurysm, carotid artery, where there is a blockage of the artery to the brain. We'll take who suffer from the stroke. We'll take care of those kind of patients, those kind of conditions and all. Then other things we'll do the other axis, like a dialysis patient who requires for a fistula, for a dialysis require a fistula and AV graft. These are the branches comes under the fields in vascular surgery. Nowadays vascular surgery has changed a lot. What was there for a couple of decades. Most of the arterial surgeries we do that when instead of open bypass surgery, now we are doing for an endovascular approach, where there is with a small incision we'll take care of the blocked vessels by putting a balloon or dilating the arteries and stenting if requires. Then similarly in the aortic aneurysms, we instead of open surgery we are doing endovascular approach, where the mortality, that means the risk complications have come down a lot. Then for a varicose veins, it's the most common problem nowadays people are suffering. This one who got most of the people neglect that one, which leads to a color change in the leg and skin becoming thickening, and it leads to the ulcer. Some people present with the bleeding from the varicose veins. For this kind of patient, we have very good facilities in Manipal, where you do the laser procedure with the foam sclerotherapy, which can be done under local anesthesia, and we'll treat them as a daycare patient. No need for admission, come in the morning, get it done and go back in the evening time. So this is a very simple procedure, safe and very simple procedure, which we are doing n number of cases in Jayanagar only, Jayanagar Manipal. This hospital is very located centrally and very easy approachable, and cost-wise very comparatively much better compared to surrounding hospitals. Other common problem, venous problem with the leg is that most of the patient comes with swelling, and the swelling of the leg, it was untreated for a day, then they will come back. When you do the scan, it shows that the deep vein thrombosis. Deep vein thrombosis is a clots in the deep vein system. It can be managed conservatively without any major surgical risks, and only by medical management and with compression stockings. Another field, vascular surgery, is most of the patients who suffer the stroke, they will have the blockage of the blood vessels which supplies to the brain called carotid arteries. These can be treated either by angioplasty and stent or open endarterectomy procedure, very safe and effective, very effective procedures. For the dialysis patient, we do offer a wide range of procedures like AV fistula creation, which for the use for a long-term results, and whoever veins are not available, then you use the graft or synthetic graft for the dialysis sake. These all will be done under local anesthesia, and they come in just in the daycare procedure. We in Manipal, we do number of cases, these cases which are much very got all the facilities to do all these surgeries.